spectre of measles appears to be growing. The National Institute for Communicable Diseases confirming that throughout the country there have now been 911 cases of the incredibly infectious disease. A measles outbreak has been declared in all provinces except the Eastern Cape. Dr. Kerrigan McCarthy is a senior pathologist at the NICD. Dr. McCarthy, good afternoon to you. How quickly is this outbreak spreading?
Good afternoon, Stephen and listeners. Actually, contrary to the numbers, some in-depth calculations to estimate what's called the reproductive number of the measles outbreak suggest that the outbreak is coming to an end. The South African Centre for Epidemiological Modelling and Analysis has conducted an investigation on the rate of accumulation of measles cases. They've been doing this behind the scenes for a number of weeks, and with their support, we do believe that the measles outbreak is on the decline.
Why would it be declining? Would that be because most children, most people in South Africa are vaccinated and the vaccinations are working?
Yes. So what has happened is that the various provinces have mounted vaccination campaigns, and these vaccination campaigns initially targeted children under the age of 5, and then towards the end of March targeted children from the age of 5 to 15 years, reaching them primarily through schools. The vaccination campaign came to an end at the end of March, and we are seeing a decline in the number of cases that has been reported every week, and certainly we are seeing a decline in the number of samples that are submitted to us for testing. This suggests, in fact, that there are fewer children presenting at healthcare services with fever and a rash, and one of cough, conjunctivitis, or a runny nose. And this constellation of symptoms is what we call the case definition for measles, and clinicians should then take a blood sample and send it to the NICD for confirmation that this is in fact measles. So the number of samples that has been submitted every week has decreased, although we are still seeing positive cases come through. In the last week, for example, we saw in that week 12 of the current year, we saw 40 positive tests come through, predominantly from the Limpopo province, but then also from Gauteng and sporadic cases, so a single case only from Mpumalanga, 3 cases from Northwest, 1 from the Western Cape, and 1 case from the Free State. So we're definitely seeing a quietening down in the number of tests submitted and the number of cases that have tested positive. Persons are still at risk for measles infection if they've never been vaccinated, and if they come into contact with a suspected case. So it's likely that we will see a few more weeks of cases being reported. However, the general trend and the mathematical modeling suggests that the outbreak is on the decline.
How long does it take from being vaccinated, for the vaccination, so getting the injection in the arm, for, it's not actually that, is it, to actually for the vaccine to take effect? In other words, you would expect pretty quickly after the vaccination sort of rollout that you did that we would start to see this change, right? Is it in line with that expectation?
Absolutely. So the measles vaccine is what we call a live attenuated virus. So it is, in fact, the measles virus itself that has been substantially weakened so that it no longer causes side effects, but it elicits an antibody response that is equivalent to the antibody response that happens when a person gets measles infection due to the actual wild measles virus. When a person gets measles vaccine, within 10 to 14 days after receiving the vaccine, the antibody levels are sufficiently high to prevent an infection. So all the children who've received measles vaccine are effectively protected within that time frame. That's within 2 weeks following it.
And if you had measles or were vaccinated when you were very young and you're now fairly elderly, could you still be at risk, or does the vaccine and do the antibodies, do they work literally forever?
So the phenomenon you're speaking about is what we call waning immunity. So if the measles vaccine takes, in other words, if an individual receives the correct dose of a live, active measles vaccine, and they develop antibodies in response to that vaccine, the immunization is lifelong. So there is no need for a booster vaccine, and we do not see cases of measles in older adults. There are a few exceptions, individuals who develop an immunocompromising state or compromised state in adulthood or for any other reason, such as advanced and untreated HIV infection or cancer chemotherapy, they may their antibody levels may drop and they may become susceptible to measles again. But by and large, individuals who have received measles vaccine are immune for the rest of their life. And this is why the outbreak cases that we have seen over the last few weeks, since week 40, October 2022, have been predominantly in children. So the measles outbreak that we see takes advantage of what we call an immunity gap. So individuals who have not been vaccinated or not previously infected due to measles virus are then those who are susceptible, and these are the children in whom we see measles cases during an outbreak. So we can be reassured that adults or those who have received the vaccine in their lifetime are protected for it.
Dr. Kerrigan McCarthy, thank you. Senior pathologist at the National Institute for Communicable Diseases.